as it relates to updating technical standards, for every part that we reviewed, technical standards were updated in every area. So there may actually be other areas of code, though, that don't have updated references to technical standards, but that work will come. Updates to worksite party responsibilities occurred in a number of areas across the OHS code. The updates were designed with the goal of supporting a strong internal responsibility system. In some cases, code may not have actually have the correct worksite party responsible for health and safety, or it may not state who is responsible, so additional clarity was required. An example of this is in Part 5 confined space around testing confined space atmospheres. Wording had to be amended to identify that it was the employer's requirements. These aren't shifts in responsibility, but they align with the roles and responsibilities defined in the OHS Act. Changes in the OHS Code in this category primarily occurred in Part 33 explosives. They also occurred in confined space, Part 5, Part 15, which is managed control of hazardous energy, Part 36 mining, and Part 37 oil and gas wells. Fairly certain that none of those will actually affect this group here today. The fourth category of changes to the OHS Code involve removing the need for stakeholders to submit acceptances. Acceptances are a burdensome process on both the stakeholder as well as the department, and they're only granted in conditions where equal or greater health and safety protections actually occurring. In 3 specific cases, changes were made to the OHS Code to incorporate the requirements into the legislation and remove the need for acceptances. In Part 15, Managing Control of Hazardous Energy, we actually included a reference to submitting professional engineer certification for around complex group control. In Part 5, Confined Space, requirements for remote monitoring of confined spaces have been incorporated to basically address the technology that's been available. So in both of those situations, in the confined space one, we've actually been issuing acceptances for almost a decade. And with the confined space change, that's actually something where we issued the first allowance to, which is a method for us to be able to change the legislation temporarily until we actually change it formally. In Part 11, this is the area that probably interests most of you. First aid hospitals, medical clinics, physicians' offices, and nursing homes, as they relate to the Nursing Homes Act, have also been submitting acceptances for more than 10 years for certain medical professionals to not require first aid training. The changes to the OHS Code remove the need for medical professionals in certain settings that have first aid training in addition to the training required for their profession, which eliminates the need for them to submit for an acceptance. Again, addressing situations where acceptances need to be granted is a priority item for reviews of the OHS Code in the future. As mentioned earlier, again, in the timeline, it was intended when the code was enacted, it would be updated on a regular basis. But the last substantive revisions happened almost 14 years ago. In 2014 and 15, changes to the code were actually consulted on, but they weren't enacted. Technology and work practices have evolved significantly over the past 2 decades, and OHS requirements need to keep pace with modern practices as work processes and equipment advances. One example of a change to the code that was made to modernize legislation was introducing requirements regarding autonomous equipment that are used on some work sites. So that includes things such as self-driving vehicle. Also, a new requirement in Part 16 around noise was introduced to better protect workers from noise-induced hearing loss. So the threshold for noise exposure assessments has been lowered to evaluate the noise before the exposure limits exceeded. This modernizes legislation as the lower action limit for conducting a noise exposure assessment aligns Alberta's requirements with best practices and with the scientific research of the high costs of noise-induced hearing loss. Modernizing OHS legislation also involves adopting new standards or applying requirements to industries or segments of industry they didn't previously apply to. An example of this is in Part 36 for mining. We actually made a change. So for some areas that previously applied only to underground coal mines, they now actually will apply to underground mines. Currently, Alberta only has underground coal mines, but the potential for other underground mines, other types, is possible, and legislation needs to be relevant to future conditions. So let's get into the actual changes that were made in the code. And this presentation is only the highlights that are across 8 core topics. So in the spring of 2021, a 6-week online survey was launched to consult on 13 different parts of the code. Some of those parts were included in the changes that came into effect on December 1st, including around health and safety committees and radiation protection. Some of the changes are being proposed for future years, and then the remaining have actually been grouped into 8 topics. Of those 8 topics, 5 of them are applicable to all industries, while only 3 of them are applicable to specific industries or activities. So the next 8 slides are going to provide a highlight of each of those. However, the specific industries and activities, we're actually going to just jump right over those, as they don't relate to this group. So in Part 11, First Aid. For First Aid, 2 of the largest changes were made to harmonize training and First Aid kit requirements. The newly referenced CSA standards at 12.10.17, which is around First Aid training in the workplace, harmonizes First Aid training standards in Canada. Alberta's adopted this standard as part of an initiative to ensure consistency in First Aid training across Canada. The definitions of First Aid training courses have been changed to align with the CSA terminology. So, for example, emergency First Aid and standard First Aid are going to be amended to basic First Aid and intermediate First Aid. In advanced First Aid, there's no change. But that's not going to affect work sites, as First Aid training certificates will still be valid until their expiry date. So many training agencies in Alberta have actually been including the CSA training terminology on their cards already. If you have current First Aid training, I'd recommend that you actually check your certification to see whether or not it says if it's basic or intermediate for the CSA equivalent. Alberta's also adopted CSA standard said 12.20.17, which is actually around First Aid kits for the workplace. This was done to harmonize First Aid kit content requirements in Canada. The standard provides the general requirements for workplace First Aid kits. It specifies a classification system for the kit, and it sets the minimum requirements for their content based on their classification. When we had to make changes in Part 1, which is around definitions, to align the terminology, similar to what we did with the training requirements, and also in Schedule 2 to remove the previously prescriptive First Aid kit content and replaced with reference to the updated tables. A resource has been developed for stakeholders to use to compare the previous content requirements with the new requirements of the CSA standard. So what hasn't changed is that providing First Aid services, supplies, equipment, and First Aiders, as required in tables 5, 6, and 7, will still be determined by the hazard classification of the worksite, the number of average workers at the worksite per shift, and the distance to a medical facility or healthcare facility. Employers will need to reference the updated tables, and they may need to amend their First Aid kit supplies to align with the new requirements standard. Another key change in the area of First Aid was made to remove the need for regulated medical professionals to take supplementary training to comply with First Aid or requirements. So this reduces burden on the healthcare sector and government by removing the need to issue certain types of acceptances. So this change affects hospitals, medical clinics, physicians' offices, and nursing homes as defined in the Nursing Homes Act. And this is where a physician, nurse, or licensed practical nurse, or LPN, is always readily available. Finally, we made some administrative changes to streamline wording and improve clarity and remove duplication. Changes to Part 15 around managing control of hazardous energy should actually be quite minimal to stakeholders. So we aligned some worksite party responsibilities with those that are in the Act. We did things like change from a worker designated by the employer to a supervisor or worker for securing energy. And that's because supervisors have obligations in the OHS Act that are defined there. The requirement for complex group control, this is another example of an acceptance that's been removed. The requirement for complex group control procedures to be certified by a professional engineer has been included in this part to remove the need for acceptances of these procedures. There's a little bit of history around this in terms of some changes that happened in 2018. However, we needed to remove the administrative need for an acceptance, and those acceptances actually did require professional engineer certification with the complex group control procedures anyway. So by incorporating it into the legislation, it makes it easier for everyone. There was a clarification on the placement of workers when they're pigging, make sure they're safely positioned so as not to be hit by the pig. We had some new definitions that went with it, but just for your information, pigging is a highly hazardous activity that happens in the oil and gas industry. Finally, other changes to Part 15 involved administrative changes to streamline wording, improve clarity, remove duplication. For Part 16, for noise, included updates to technical standards to the current versions of and updating terminology to align with the standards to reflect current technology. Two key requirements that have changed in this area may require action on the part of employers. However, the updated requirements reflect best practices for health and safety. So firstly, the action limit for conducting noise exposure assessments has been reduced from 85 decibels on average to 82 decibels, and that's to harmonize with other Canadian jurisdictions and support prevention of noise-induced hearing loss. The reduced action limit will support prevention of workers from being overexposed to noise. Secondly, there's a new requirement for fit testing of hearing protective devices. Ensure they provide the protection intended. The reference standard indicates that hearing protection must be properly fitted, but it doesn't prescribe a method, so fit testing can be done either quantitatively or qualitatively. Quantitative methods, however, they're the best practices. They're also more accurate with evidence to show that they support prevention of hearing loss. There's a cost associated with quantitative methods, and those costs are actually balanced by a higher level of protection to workers. These current provisions provide employers with the flexibility to determine which method they will use and how best to accomplish getting their workers fit tested. In this part, clarification has been made related to the competency of the person conducting noise assessments. Employers have to ensure that a noise exposure assessment is conducted and interpreted by a competent person who's got a number of different competency qualifications in there. So competent person was actually something that was already defined in this area. And so we don't actually have a specific course that will actually identify which course the noise exposure assessment measure has to do. However, that might actually be something that previous persons have done in the past to help them become competent in the first place. And again, other changes to Part 16 for noise included streamlined requirements for audiometric testing, though the introduction of a technical standard was made to replace prescriptive requirements. We had to make some updates in Schedule 3 to update with the technical standards, but otherwise everything else was administrative. In Part 1740, overhead power lines, the main change that happened here is there was a reference to a technical standard that's been updated to the standard that the utility industry actually uses. So the requirements in Part 17 or Part 40 haven't actually changed, but the standard that's referenced now will provide greater protection to workers because it covers a broader range of topics that are required for that particular industry. In terms of miscellaneous changes, we actually made them throughout the OHS code and grouped them here as miscellaneous. However, they do actually cover across a number of different types of changes that were made. So in Part 1, we actually made changes to almost 90 definitions. That was either by amending them, removing them, or adding definitions to align with the changes that occurred in other areas of the code. So the full list of changes to the definitions can be found in the amendment regulation. Just for your note, the electronic version of the consolidated OHS code should be available shortly. Part 3, I already mentioned this earlier, that Section 12 was amended to include explosives in the requirements for manufacturer specifications. Part 5, confined spaces, introduced a new option for the use of remote confined space monitoring, which is the removal of the need for the acceptance. Part 6 had a small change in Section 97 in the inspection frequency for roofer hoists. This changed from daily to reasonably practicable intervals to provide flexibility. Another area where this occurred was actually in around suspended scaffold, which was the same change. As reasonably practicable intervals is something that's referenced in other areas of the code to provide employers with flexibility to conduct inspections based on the realities of their work sites. One of the RCT agreements that was made, so that's the agreement to align with the Canadian Free Trade Agreement through RCT, was actually made across a number of areas related to fall protection and personal protective equipment. So these updated the technical standards to align with the harmonization of those. That occurred in Part 9, which is fall protection, Part 18 for PPE, Part 39 for tree care operations, and Part 41 for work requiring rope access. Basically, what the standards mean is that there is a universal TSA standard that all personal protective equipment and fall protection equipment aligns with. Made some changes to Part 25, and that was actually made to align with Part 37, which is oil and gas. So we actually had a change in there regarding contact by clothing and PPE and any other thing that may cause a hazard to workers. And that's to align with the intent of the provision, which is to prevent anything the worker is wearing from being caught and creating a hazard. We made a change in Part 32 to remove the word open from an open pit mine. There's some definitions that actually changed for the Part 36 mining, which is to, which does actually make a new definition of pit. So we need to change those definitions too, and certain areas. For Part 33 explosives, we made some updates to technical standards. We actually consolidated an entire part of Part 36 into this area, streamlined everything, and updated. This is one of those areas where the regulations, when they were put together in 2003 and actually put forward, are the ones that was completely separate. If you'd like more information about this slide and the next two slides, I'd be happy to answer them at the end. Part 36, a number of significant other technical requirements were updated. Part 37 is for oil and gas. We actually included several new requirements. However, a number of those requirements were actually asked for by stakeholders to improve health and safety on oil and gas well sites across Alberta. So I just want to make a note about ticketable provisions. We did actually remove 6 ticketable provisions from those technical areas that are industry specific. So that's the explosives, mining, and oil and gas. We actually didn't change or remove the sections, but what we did is we changed it from a performance-based into a performance-based requirement, and then that made the provision no longer suitable for tickets. Of the 5 related to ignition sources near explosives, and 1 related to record keeping, but no tickets were actually ever issued on those provisions. In terms of resources available, we've actually created 6 highlight change bulletins for resources for stakeholders to help better understand the changes that are coming. The 2 that aren't in there are the ones that are highly technical, which is the explosives Part 33 and the mining, which is Part 36. However, we've got ones for noise, first aid, managing control of hazardous energy, overhead power lines, and then oil and gas. As always, as stakeholders have questions, they can always reach our OHS contact center. They can go online through the Ask the Expert function to ask a question. They can also actually visit our publication store, which is where those highlight change bulletins are. For the future OHS code changes, we've got an OHS code review webpage, and then we've got an email address at lbr.ohsreview@gov.ab.ca. That's actually kind of a dual purpose email where stakeholders can either ask questions about the current changes that are happening and the implementation of those, or you can actually submit suggestions for future OHS code topics and your rationale for those. So as I mentioned, there are 2 resources that are still under development, and that's for the explosives and mining parts. We are developing a concordance document to clearly identify the section changes and where everything went, if it did actually go somewhere else. We've consolidated the legislation electronic version, which should be available actually sometime this month. You can actually order OHS handbooks, those blue books, from the King's printer, but they won't be available until at least March of this year. Plus, we are trying to do more presentations as time goes on. So in terms of implementation, how will enforcement look? Overall, there's not really going to be much change to how enforcement of occupational health and safety legislation is done. The current provisions are not actually enforced until March 31st. However, we're going to continue to educate up until that point when they will actually become law. These changes, as I mentioned on the types of changes, they're technical requirement changes. So it's not the same as the changes that happened in 2018 or 2021 when there were changes to the OHS Act that actually changed things from prescriptive-based legislation to a performance-based legislation, or the introduction of the internal responsibility system. So in terms of the changes themselves, they should be relatively simple to implement. We've actually created a number of resources, and we're trying to answer questions as they relate to specific work sites. And these changes are designed to enhance health and safety. So stakeholders can actually implement the changes prior to March 31st, as many of the actual changes will increase are over and above or either equal to what's currently required. So as part of this process, we've actually developed and published a code review plan and process. It is a 6-step cycle where we start off with research and prioritization, which is a call for topics for review. We consider stakeholder feedback and changing work processes. We consider things like the harmonization through that RCT agreement, so maybe some evolving issues, research, compliance and enforcement data, and we'll prioritize those topics and publish a 3-year review plan. So we've actually done that. Technical analysis is part of that next phase of this policy development cycle. So we actually will do an initial drafting of the proposed changes, engage with external experts, maybe some technical working groups where required, and then that supports proposals for consultation. Next up is public consultation on the actual changes. So typically it involves some kind of survey for stakeholders or direct submission. This is public feedback that's analyzed, and the proposed changes are adjusted based on that public consultation. Next, we move to government approval for the proposed changes and publish with an in-force date. Finally, we get into the implementation side, which is one of the stages we're in, and that's where worksite parties are expected to be in compliance with the requirements on the in-force date. So to support understanding of these changes, we're developing those resources, and that's actually going through things like the bulletins, web content, e-news, direct presentations like this. We've got information on any kind of contact report that's being delivered by OHS officers, a number of different areas to help stakeholders understand what those changes are and be able to come into compliance with those requirements in the in-force. So that's the implementation stage. And we try to do as much stakeholder support and outreach so that as needed. The next step is about evaluation. And so evaluation actually is typically a stage in a policy cycle that can not necessarily be done consistently. And so what this stage is designed to do is it's designed to ask, how can the OHS code improve health and safety outcomes for Alberta workplaces? How can we actually develop and improve our review process so that as we release new changes that they actually go more streamlined? That involves a lot of feedback from the public, from members such as certified partners, from groups like yourselves, to be able to actually provide us with information to say, you did this right, and this worked really well, or you need to improve on this, and let's do this next time. And so as we continue to develop and further refine the actual either process or the legislation itself in terms of getting the information out, we can improve it so that it's easier for stakeholders, and so it's much more of a streamlined process. This is actually an area where stakeholders provide a vital area in being able to respond to surveys that we send out about information specific to your worksite and conditions. But I mentioned earlier towards the presentation about some priority review for future changes to the OHS code. So we actually have 4 items here. So the issued allowances, approvals, acceptances, and recognitions. We had 3 this time around that we actually included into the legislation that it made sense to. Those processes are fairly robust. And again, they're only issued in cases where there are equal or greater protection for worksite health and safety. The next priority review item, which would be on that regular review cycle as we review changes to the OHS code, we'll review recommendations from public vitality inquiries if there are any. The items that are in the work plan under the Canadian Free Trade Agreement or the RCT, the Reconciliation Cooperation Table, that's another priority item for review. So as new items and agreements are signed, that actually then will become a priority inclusion into the changes. Currently, right now, what I'm aware of for the other two items that are actually on the agreement work plan include occupational exposure limits and health and safety management systems. I believe, however, if you go and Google it and look for the actual information, health and safety management systems has actually been deferred indefinitely. And then finally, another area would be correction of errors and modernizing language. For our 3-year code plan that we've actually published it between 2023 and 2026. You can see here that we've got a number of different topics that are in each of those years. However, I just want to make a note that that doesn't necessarily mean that changes will be occurring in those years. And this is just to the OHS code. So, for example, this year we have part 33 and 36 in the identified parts, which is explosives and mining, explosives and mining. Now, what we'll probably do is, because we knew that we actually didn't finish the work that was done because of how technical it is, we're going to reform some technical working groups and validate that information. It's kind of like a little bit of a mini evaluation to see what other areas need to be improved on. Part 27 is violence and harassment, which is an item that actually is on the current plan to be looked at, and then occupational exposure limits. In the following year, we actually have 8 topics that we've actually identified as that year, but that doesn't necessarily, again, mean that those are when the changes are going to be happening. Changes actually, and that just means that work is going to be done in these areas to start looking at that initial part of the policy cycle. So that phase 1 of the policy review cycle is where this is actually slated to actually happen. Changes could happen down the road depending on what other priorities come forward. In terms of the approval process for OHS code changes, it is a little bit different than the OHS Act. So priorities for a proposed change in regulations, they're informed by government mandates and ministry direction in addition to health and safety priorities. Ministry staff develop the proposal for the changes, but that's the research, engaging with technical working groups, consultation results, legal review, and then analysis by staff. We make a proposal for changes for government to move forward on based on the type of policy or legislation, and that actually depends on which committee it will go to. In the case of the OHS Code review, it's the Economy and Affordability Committee who reviews the proposal, flags any concerns to be addressed before it goes to Cabinet. So I mentioned, unlike the Act, changes to the code don't go through the approval as a bill in the legislature. Cabinet reviews the proposal and provides policy approval. Legislative Review Committee then actually looks at and provides approval of the actual changes. There can be a little bit of back and forth between these two groups to address any issues that they have. But once that Legislative Review Committee approves the changes, what has actually happened with the OHS Code is a ministerial order is made to the OHS Code, which is then signed, and the regulation is filed with the King's Printer. So that's actually what happened this time, where there's an amendment regulation that's filed under a ministerial order. The consolidation of the OHS Code is actually just part of that. So what it is an existing code that is actually consolidated with an amendment regulation. You'll see through the new version that'll come out, anywhere where there was a change in the amendments, we'll actually have a citation noting it. So usually new requirements have an implementation window before they come into force, which in this case, we made the announcement in mid-December and they'll come into force in March 31st. So in terms of being members of a certifying partner, we want to actually ask that the members share resources with your groups. Update training is required. So it's what we're asking of CCSA. Survey and compile feedback about legislative changes, and that's the evaluation piece. Once we actually have these changes rolled out, we want to know how things are going. And then participate in engagement and consultation of future phases, legislative changes. And with that, I would be happy to take any questions. Oh, we've got a nice big chat box.
Thank you, Paula. Okay, and we will go through the questions, and most of the questions are actually revolving around first aid as expected.
Yeah.
And we'll start with Norm. Norm actually opened up the questions here, and he said, do we still have to get, or would annual CPR still be required? And I think Ria also alluded to that question.
So annual CPR is probably part of your supplementary training. And so in the exclusion, I actually have my amendment regulation right here, so I can actually read it out. And this is as it relates to first aiders and their training. So the actual legislation. Of course, so then I went and moved it. Help me out here. Oh, I did have it on the right page. Okay. So the section as it relates to is actually it's section 181. And so that's about first aid providers. So an employer must designate first aiders in accordance with Schedule 2, except as provided, ensure workers designated as first aider completed training in first aid from an approved training agency, and make and maintain a report of workers at the worksite who are currently designated as first aiders. So 181 has a number of other areas as well in terms of the if an advanced first aider, advanced care paramedic. So some other requirements there. So that section 181 that is new, 181 step 4 says this section does not apply to a hospital, medical clinic or physician's office, or a nursing home as defined in the Nursing Homes Act, where a physician, nurse, or licensed practical nurse is always readily available. And so under the terms that might have been under an acceptance to have something like annual CPR training, if there is no longer an acceptance requirement, then no, I do not believe that you would still have to do annual CPR training. However, employers can actually enact rules and requirements over and above the minimum standard of what OHS actually indicates in the code. So my suggestion would be talk to your employer about what their first aid plan involves with the updated changes effective March 31st, and find out whether or not that is a required training that your facilities will still need to do, provided that you fit into one of those categories. So it is tied to the Nursing Homes Act as defined there, and that does actually cover physicians, nurses, and LPNs.
Okay. Thank you, Paula. Then to add to that, Ranjit said or is asking, does all of the healthcare aides require first aid training as well?
So again, you still have to submit to the other requirements that are part of Part 11, and designate those first aiders. And so if you've got a situation where, again, it's those locations. So I would actually suggest that you actually talk to your employer, take a look at the legislation, work with your certifying partner group to determine how this is actually going to work for members. And so, if there's a healthcare aid on one of those sites, does that fall into it? Well, because we've actually got it tied to the site, and the other qualification is where a physician, nurse, or LPN is always readily available. And so there's two preconditions here. One is it's tied to the type of location, and the other one is the type of professional that's there. That's the exclusion part where it says this section does not apply. So you have to meet both of those requirements. So I can't answer specifically whether a healthcare aid would require it. It depends on the situation based on those two preconditions. So Alberta OHS enforcing first aid requirements in long-term care. I'm assuming that this actually relates to having first aid. So again, just go back to that precondition requirements, that the requirements for having a first aid certificate or doing that supplementary training that might have been formally through the acceptance, the terms and conditions of the acceptance would no longer apply. But I would suggest to take a look at those tables and see. Alberta Occupational Health and Safety, in terms of enforcement, has a number of different programs and areas. that they will actually go through. So we do and have in the past had healthcare initiatives where we've worked with different groups and employers to go and conduct inspections in more sensitive areas like this. And so I don't believe that there's anything specific right now, but there could be in the future. Fit testing, and I will actually just make a note here. Give me just a minute. I will apologize. My laptop dies. It just went into power save mode. Sorry about that. So noise fit testing. So the standard actually does have it mentions that a regular interval, I believe is what the term is actually called, and then it recommends 2 years. That's the part where it's the recommendation in there. So workers similar to fit testing of RPE need to be fit tested to the equipment they're going to use. And so if they're going to continually use the same hearing protection and they're fit tested on it, again, the recommendation is but difference between RPE and fit testing of hearing protection is that your ear canal does not change quite as frequently as your face might over a 2-year period. And so there's more need to have that fit testing of respiratory protective equipment than hearing protection. But the recommendation in the standard is that it's on a regular interval, and then it does suggest 2 years. Would noise exposure apply to the sound of fire alarms going off in a facility? And would hearing equipment be required for this? I would suggest that you probably take a look at how frequent that fire alarm is going off, and whether or not it's included and addressed in your hazard assessments, before actually determining whether or not a noise exposure assessment would be needed. So that's kind of the first part. Noise is a hazard. You do the hazard assessment, determine what controls can be in place. So I can't specifically say whether or not noise would specifically be included with fire alarms. They are quite loud. It's also that the exposure limits are typically over an 8-hour period. There are higher levels that are obviously over a shorter period in our tables, but I was just starting off with hazard assessment and identifying whether or not there is a need to do a noise exposure assessment, which then determines that. There's a question here for CCSA about the audit tool.
Yeah, and I can speak to that. Thanks for the question, Bram. So the question in the audit tool doesn't change at all. What will be required is for auditors to confirm the qualifications that Paula spoke about earlier. So what type of facility is it? Community is it? And then what type of professionals are in that facility? And then determine whether or not there's appropriate coverage across all shifts. So it's a similar process to what you've always used in the past to answer that question. It's just the inclusion of type of facility and type of professionals in the facility that an auditor will need to look at.
Yeah. There's another question here. Long-term care, we're still required to have a first aid kit. That 181 sub 4 about the section not applying to certain locations under certain conditions is for first aid providers. And so the rest of the requirements in Part 11, I believe I answered that earlier, are still applicable to Worksite. And so there is no exclusion. The part that's been updated is the CSA first aid kit contents are a little bit different. So there's a bulletin that actually has a comparison. If you had a number 2 before, and now you're looking at a type 2, then there's a little bit of difference in the contents. I'd assume that most of your work sites are probably classified as moderate hazard. And so very few administrative unless you're in the office only. So under the moderate classification, that's now going to be a type 2 kit. And so we have a nice little table that'll actually compare it. So you don't actually have to reference the CSA standard. You can see what your existing kit and your current kit has and what equipment or contents you need to add. I would actually know that there are some differences in the sizes of the equipment between the CSA kit and the current requirements. So currently we require a 4x4 dressing, and the CSA now says a 3x3. The CSA standard is the minimum requirements for first aid kit content. So if you have supplies that's in excess of that, that actually should be appropriate for covering the requirements in there. There's a change here that I just want to address about purchasing the booklet every time. So right now, the OHS code handbooks are available to purchase, but they're going to be available in March. As we move forward with future changes, you may want to reference an electronic version, which is acceptable. We do actually have that provision in the OHS Act that it is readily available, and that does actually include an electronic format. And what's funny about this is that I didn't realize my battery on my laptop is as bad as it is, and the new one that I have with a brand new battery is actually sitting at our security desk. So I was like, no, I don't want to change my computer just yet because I want to wait until after this presentation, and apparently so. The other question here I'll grab is Nursing Homes Act. So is rescinded the spring of 2023, replaced with a Continuing Care Act. Dana, you'd mentioned that and asked it before. Typically what happens with legislation is there is a reference for the version that supersedes it. And so if that's the case and it's being replaced with it, there'll be a notation in there on open government that will actually say superseded by such and such. And that's typically what happens with legislation. The reference in Part 17 that I mentioned was a technical standard that was updated. It was actually a version from 2002 that doesn't exist. There's now a 2014 version that has a completely different name. It still is applicable. However, the actual words in the code were not correct because they weren't current. That particular reference didn't exist anymore. So it's a little bit of a hierarchy, and it kind of goes up to the up there. So for whatever version is replacing it, and typically the Continuing Care Act will actually identify that this is replacing version of this with a specific numbering to it. So